Assalamualaikum and a very good morning to you all. I hope you guys are doing very well today and you're ready to start your day with Shazad Khan and Maha Mukhtim only on PTV World this morning. Assalamualaikum Shazad, how are you?
Walaikum assalam. I'm absolutely great, and
Great.
that's what we hope over here at PT World, ladies and gentlemen, that everybody and each and every one of you is doing great. And the other best part, Maha, is that I was so unaware of the fact that I had to come to work today. And the only reason when I got to know about it was that my daughter, who's actually 4 years old,
Yep.
was getting ready for school after two and a
Aww.
half months or 3 months probably.
How does that feel now that she's all ready?
So now when all of a sudden, she came in and she was like, Abu or Abba, I'm going to school and I'm all set. Take a look at me, how am I looking? And I was like, Bede, you
Aw.
look great. And that's the time when I realized, oh my God, I have to go to work too.
Okay.
So thank God, thank you, Shabano, for coming and telling me and waking me up
So,
as well.
so basically, if it's not your mother that's waking you up, it's your daughter.
Yeah.
Do you ever wake up by yourself?
Yeah, at times. For example, if I slept early at night,
Yeah.
that's the only
You
time
know-
when I'm going to get up at probably 4 or 5 in the morning.
Okay.
And then I have to go back to sleep as well. But other than that,
But
I think
surely
it was
if you go
superb.
back to sleep, then it's more difficult to wake up at 7.
It is usually,
Yeah.
if you fall back to sleep. But for all those kids who are going to school, happy school going, please make sure that you're more focused and you're more determined to achieve your goals.
Exactly, and have fun with your friends as well, seeing them after a little while,
Yeah.
probably. So now I think we have to start with our top stories because we have got a information jam-packed show for you today. So let's take a look at the top stories and we can start the show.
Let's do it. Former Interior Minister Chaudhry Nisar Ali Khan has said all terrorist networks and centers have been dismantled in the country. Only limited network of few facilitators and abettors remains to be destroyed.
Punjab Chief Minister Shehbaz Sharif has said the PMLN government is committed for the development of agriculture and prosperity of farmers.
Over 128,500 Pakistani Hajj pilgrims have arrived in Saudi Arabia under the government and private Hajj schemes.
Excellent. And a manhunt is continuing for the main suspect of the Barcelona terror attacks as the residents start recovering gradually from the atrocity. Moving on to the car rally.
Babar Khan wins the 3-day Sarfaranga Cold Desert Jeep Rally in Skardu area of Gilgit-Baltistan.
And finally, moving on to the weather. Okay, so moving on to the weather, we don't have the visuals. Mainly hot and humid weather is expected in most parts of the country during the next 24 hours. So more humidity, more heat. But it's fine. We're almost through the summer.
Well, I don't think so
No?
because, recently when we did a show about climate change, I think this is what they were telling, that it's
Yeah.
going to take another month at least where you're going to experience the change in the weather. And other than that, Ma, it's not really that hot these days. I mean, initially,
It's not?
when summer started, we faced temperatures going up to 42 degrees centigrade and
That's true.
whatnot. But now it's usually during the daytime 34 degrees centigrade or 36. But because of the fact that it's raining and it's humid, we feel more hotter.
Yeah.
So it's going to be better.
Okay, I hope it gets better soon because the humidity, also my hair is not doing well in the humidity.
Same
but
here, man.
anyway, yeah,
Might just
exactly.
stick to the scalp.
Okay, so now moving on to our show, we have a very important show for you. And, we like to highlight different health days and different problems within the city.
Exactly.
But this is something that the whole world goes through.
And before you give it away, I think we have got a public service message to share. So let's go. Let's take a listen to what Maha has to say about the public service message.
Yes. Okay, guys, so our public service message, which I almost skipped over, is as Shazad mentioned, his daughter's going back to school, and all the kids are now probably back at school. So when you are driving, I know I keep doing
Road rage.
public service messages, but I do suffer from that. Be careful because they do run out and they are everywhere, and no one tends to look when they're crossing the road. So please be careful.
And exactly, and there's this one very practical thing which I need to share, and that is that it usually happens to me every time I go to pick up or drop my daughter, because as soon as I open the door, she starts running, and you have to be like, oh my God, man, don't go anywhere, please stop, because nobody else other than that, you know, because you are the father or the mother, whoever is there, they're very cautious about this fact, but kids have no idea what's happening all around the globe. All they know is there's this gate, the door opens, start running.
Exactly.
Please make sure that you are very cautious about it.
And now, linked to children, we actually are going to be talking about before kids are born. So basically, when the mother becomes pregnant. So the topic of today's show is the issues that are related with pregnancy, pre, during, and postnatal. Now, you know, we all have this idea, this romanticized idea that we're taught from our families, from our mothers, from our grandmothers. Then you have Hollywood and Bollywood and Lollywood teaching you something else in dramas. But there's no actual, you know, real knowledge that people have that this is the biological changes, these are the psychological changes, and these are the social changes that will occur to you once you fall pregnant.
Exactly. And most of the time, in fact, what I've seen is that for all of those celebrities who get pregnant, and whenever they're walking the red carpet, so, you know, the picture is very differently portrayed. And this is where we come in. We are going to tell you what the real facts are. Because half of the time, men complain that, oh, you know, she's got mood swings these days. She wake up at night and she asks for this thing to eat. How can I bring it back home? And the concept of being pregnant is not for the lady or the mother only, or the mother to be. It's for both of you guys. So it's like we are pregnant.
Absolutely.
I think if we'll walk on these lines, everybody can consider that it's going to be a beautiful pregnancy.
And also, even from the West, you know, people in the spotlight have come out and said they have a whole army of people that make them look this good or feel this good. So let's introduce to you our guests because we have got a lot to cover. Dr. Farisa Vakar, she is the head of department at the Islamic International Medical College, Rifa University. Assalamu alaikum, good morning. Thank you so much for joining us today.
I like your shoes.
Very cool. Besides Dr. Farisa Vakar, we've been joined by Dr. Sayyida Batul. She is the head of department, and I have lost which university, but
Shahid Zulfikar Ali Bhutto Medical University.
Zarist.
And it is PIMS.
PIMS. Thank you so much for joining us today. Besides Dr. Sayyida Batul, we've been joined by Dr. Tahira Batul. She is a gynecologist and an infertility specialist at the Australian Concept Infertility Center in Islamabad. Assalamu alaikum. Good morning. Thank you so much.
Thank you very much for coming over, and I think I'm going to take the liberty to start the conversation, and that is that whenever, you know, young people, when they got married, so the first thing which has been taught to us by our parents, or I don't know whether these are the norms, that, you know, the first thing you need to probably do is, you know, have a baby, right? They do not give them time to settle down or probably go away or probably, you know, spend some good honeymoon days. So let's start from the conception of the baby itself, because it gets difficult for people who haven't really settled down. Do you think this is what the scenario is, or it's not like that?
Yeah, you're very right. Once people get married, you know, the whole family starts expecting that the girl will get pregnant day one, you know. And if she's not, they keep asking her every month, you know, why she's not pregnant. And I think the girl should be mentally prepared, plus physically prepared for this. And there are certain things which she must take folic acid preconceptually 3 months before she gets pregnant. And then think about how they are going to raise the baby once the baby is born. And all these social problems should be dealt with before, you know, and her health issues. Maybe she has less blood in her, which is anemia. So she has to complete, you know, her blood should be full. She should not be anemic. She should, her health should be better. If she's hypertensive, the blood pressure should be controlled, and things like that.
Let's start from that point then. So what is it that, you know, people who are trying to conceive, what are the health things that they should take into account? Which tests should they get done before they try to start conceiving?
It's very important that, you know, like...
She said anemia.
Yeah, anemia is very important,
count,
hypertension. And then diabetes. Diabetes is very common in Pakistan. And sometimes there is no diabetes preconceptually, that once the girl gets pregnant, she turns to become diabetic.
Right,
And
okay.
it's called gestational diabetes mellitus.
Okay, so we'll talk about that in a moment, about the issues that can arise during pregnancy. But before we get on to that, let me ask Dr. Sayeda, you know, the idea is, like Shazad said, you know, you get married and then people expect you to be pregnant within the first few months. But it's actually not that simple. Is that correct? So a lot of people actually struggle. It takes about a year for a lot of people to conceive.
Actually, it's very nice to tell people the statistics. A healthy young couple living together, they have a 10% chance of getting pregnant every month.
Okay.
So, give them a year and 80% of them will be pregnant. But if you give them 2 months, only 20% will be pregnant, and there will be a lot of money spent on, you know, getting tests done which should not be done.
Okay.
But I think we have to realize that no matter how healthy they are, time is a factor, and first 1 year in a healthy young couple, we should not be investigating anything. However, as Farisa said, we should be making sure that her blood pressure is normal, her general health is good, and she should be taking prenatal folic acid. That is a message that needs to get through, because if she takes folic acid supplement, the likelihood of a baby having you know, neural tube defects where the head is not properly formed, or the spine, they have an open spine where the nervous system is exposed. These can be prevented just by taking folic acid, but you have to start before the pregnancy and continue onwards.
Okay.
And moving on and building up on that as well, Dr. Zaida, how important it is to be settled psychologically with your partner too as well, because other than time, you know, for somebody whom you're married to, you haven't settled down, so you know there are arguments every other day. Do you think conception will help?
Conception can help in settling down, but for conception, settling down is very important.
Okay.
Because unless you settle down, you cannot, if you are enjoying your life and you're happy with your married life and your surroundings, only then you can conceive.
So for all those mothers who've had babies and have conceived initially are happy people.
Must be, if they're conceived in the first 2 months of
Yeah.
Right. Okay. So now with the psychologically, because you're an infertility specialist, so now the pre-conception for those people who are struggling, what are the hurdles that they could possibly face?
For investigations for
Yeah.
infertility. I think there are certain couples who do need investigations from very beginning, and as Dr. Saida said, that normal couples, they can conceive within 1 year, and the couples who should ask for tests and investigations are with irregular menses and who have history of tuberculosis themselves. They have past history of surgery, abdominal surgery, appendectomy, any chronic infection in the abdomen, any history of bowel disease. These diseases, they are around the uterus and the tubes.
Okay.
And if you keep on waiting and the tubes are damaged, the time is being wasted. Sometimes the male partner has problems. They should be addressed very early and openly between the couple, and they should seek advice.
Okay.
from
All
the
right.
partner.
And other than that, there's one more point which I think is very valid, and people need to keep that in their heads, and that is that over here in Pakistan, we're too stigmatized, you know, and we're too tabooed. What happens is that, God forbid, if the couple's not conceiving, you know, the only blame game is for the lady or the girl out there.
Yeah.
And, you know, to be very fair, to be very honest, if the man steps up and if you go for your own test, your tests are very cheaper. So, you know, start from there. I think this needs to be the first step, that the men, they need to get themselves checked up.
Absolutely.
Now, but other than that, throughout this year, you know, because I've got quite a lot of people who got married in the previous year or this year, I've seen quite a lot of, or the average of miscarriages going up and up and up. What are the reasons behind that, Dr. Farisa?
Miscarriage, 25% of pregnancies, they end up with a threatened miscarriage. Threatened miscarriage is when there is bleeding, but the pregnancy is not lost. That's a threatened miscarriage. So 20%, 25% of these pregnancies will end up like that, but not necessarily that all of them are lost. Majority of pregnancies which are lost in the first trimester are due to chromosomal abnormalities and chromosomal aberrations in the baby. As soon as there's a miscarriage, the relatives start asking you, what was the reason? What happened? We were coming to you. You were giving the medicines. How come the baby is lost? And it's very difficult to tell them that it is because of chromosomal and genetic abnormalities. 90% are due to that. But other reasons could be infections, could be abnormalities in the fetus, and plus congenital abnormalities of the uterus, especially in the second trimester.
Okay, and it's how common is it to actually suffer a miscarriage? Is it?
I just told you 25% of
25%.
all pregnancies will end up in a threatened miscarriage.
All right.
It
So that's
doesn't
1 out of
actually
4.
occur.
What is a threatened miscarriage?
Threatened miscarriages doesn't actually occur. The patient only has bleeding, and then the pregnancy goes ahead and ends up in a normal, healthy pregnancy.
Okay.
Although there are certain complications associated with patients who've had a threatened miscarriage.
Okay.
But out of these 25%, 10% will end up in a miscarriage.
Okay, but other than that, is it possible that for all those women who are working ladies, you know, and because they have been working so much, or they're going up and down the stairs, because we have no idea about how it works. So you guys are
I
the
know.
experts. Do you think these miscarriages can be because of this?
I know people think that walking too much and wearing heels and too much working, all these cause miscarriages. Actually, it's not so. Stress, yes, maybe stress could do that, but not other than that, physical activity or moving too much or walking on stairs would not
working.
do it.
Serena Williams won a Grand Slam tennis championship and she was 4 months pregnant.
Okay.
So,
yes.
you know, for all those people who think like that, stop doing it.
Exactly. And now, in regards to just one thing, is chemical miscarriage or pregnancy, is that linked with this or not?
Yes, it is. Chemical miscarriage, there are problems with luteal phase defects.
Okay.
The progesterone, the hormones which help in the implantation of the baby are not normal. And because of that, they start off, so these are the patients who need to be worked up preconceptually. First brought to an optimal level of hormones, and then they can get pregnant.
Okay.
So, Dr. Saida, can you define what is chemical pregnancy?
Actually, with the advancing technology and laboratory tests being at the doorstep, sometimes we do a blood test on the pregnancy and it comes back positive. But when we do an ultrasound, we do not find a pregnancy. And that is basically a chemical pregnancy. The chemical test is coming positive, but we find no baby, we don't find anything. So that means it has failed too early. And it was just a chemical, sort of, it did happen, but it never took place inside the uterus. It didn't get settled there. So that is a chemical pregnancy, and it's not becoming more common. It's the tests which are more and more sensitive and picking up things. Previously, it is said that 25% of miscarriages happen during a normal spontaneous period, and women never know that they were pregnant. So that's Allah's way of survival of the fittest, and that's the spirit with which it should be taken.
I never knew that. That's really interesting.
So I think now we need to move on, like trimester wise. That's what we
Yeah,
call
let's-
it. That
yeah.
the first trimester, and there are 3 or 4 trimesters.
3 trimesters.
3 trimesters, yes.
You've had a child. You should know this.
Well, come on, that's how it was. It was my first child, and I was 25 years old. Yeah. So Dr. Taira, first trimester, what things do we really need to be careful about? Because majority of the times what we have seen is an iron deficiency. And, as you said, anemia and all of these things, that's when we figure it out that,
Gestation,
we
diabetes.
need to have folic acid now, and we need to be very cautious about food and whatnot.
In first trimester, we consider pregnancy for 3 months, 12 weeks. And as it has been said that folic acid preconception is very important, and the first 3 months is also very important, because that is the time when the baby's organs are being formed, the nervous system, cardiovascular system, and all the other tissues. And when the cell is dividing and multiplying, cell needs some chemicals. Folic acid is very important for cell division. And other are zinc, iron, balanced diet is very important for that. To provide a dividing cell needs a lot of energy. And if that energy is not there in the woman's body, the cells, they go haywire, and you can have a miscarriage in first 3 months. The other problems are that if the pregnancy is okay and it's going well, then women can have side effects of pregnancy hormones. Nausea, vomiting, inability to eat, doesn't like, digestive system problems are mainly, doesn't like to eat, and some women, they lose weight. And some women, they become so dehydrated that their kidneys, they are affected. So they need a proper care and look after for that.
Okay, so that's a lot of things that can go wrong with
Yeah,
the
they can.
mother of the child.
Yeah.
Now, just sorry, before we move on into the actual during pregnancy care and issues, we just want to debunk a myth. Is it true that mothers who are carrying sons are more likely to miscarry? This is a myth. In the urban cities and in the villages, this is something that people say.
I can think where the question came from.
Yeah, well, it's not from me.
I don't think it is a myth. Male child is conceived much more than a female child.
Right.
The conception, because they are smaller and faster sperms, so you're more likely to have a boy than a girl at conception.
Okay.
But sometimes I do say jokingly that we think it is the women who are the weaker sex. No. The weaker sex is the male sex.
Right.
So more boys will miscarry, more boys may have problems at birth. So that is looked after by more male conceptions which are then lost. Similarly, if you look at societies, you go to Japan, you'll see old women. You will not see as many old men. But in Pakistan, there are women dying of childbirth. So women are the stronger sex provided they are well looked after through a very crucial stage of their life, which is the pregnancy.
Okay, so that's not a myth. Oh, that's interesting. And actually, yeah, I was reading, there's some African village where the women are 4 times the number of the men. It's just huge.
And even the global population of women is actually more than men too
Just
as well.
slightly,
But
yeah.
with that, ladies and gentlemen, I think we need to go for a short break. Don't go anywhere, because when you guys are going to come back, we're going to ask them about these mood swings which take place. What are the reasons behind that?
I
I'm very
can give
keen.
you a few reasons, but let's take a break.
Book is life. Book is hope. And book is light for the future.
Welcome back, everyone. And before the break, Shahzad had a few questions to ask about the emotions and the psychological impact that pregnancies have on the women and the men.
Yeah, so what
Because it
I
has
was-
an effect on
yeah,
the men
so what I
too.
was about to ask is truly what I went through, and that was that, okay, every night, probably at 3 in the night, my wife's going to wake me up and she's going to be like, oh, I need to eat chips now, and I'm like, okay, fine, if I can get some chips, I will bring them for you. But then there are days when you do not feel like it, so then it's an argument, and then people say that these are mood swings, but I'm like, do you really lose your mind while you're pregnant, or you do not?
So let's start with Dr. Friesa.
I'm sorry for asking it this way.
In this way, yeah.
Because this is how people feel.
Yeah.
Well, mood swings, it depends on the environment at home. Like we said, there should be a compatibility between the husband and wife. If they are happily married, the woman will probably have lesser mood swings. Although it's normal to have, some women will have a lot of vomiting during their first trimester. And probably that leads to their mood swings. They get upset, they are dehydrated, and that needs to be taken care of. Plus, women in our society, there's a lot of pressure for a male child. So supposing they come to know that it's a female child, and the mother-in-law comes to know about it, she'll put a lot of pressure on this girl, and she's very upset if she comes to know that she's carrying a 4th female child or a 5th female child. So that's another problem. Another problem is that supposing women don't conceive, and then they are having a longer time trying to conceive, more than 2 years passes and they haven't conceived. So then they have to go for an infertility checkup. And like I'm also working in Australian Concept, which is an infertility center. And we have a lot of patients coming with male infertility also. So which is not recognized, and which is people don't want to recognize
Okay,
it,
but
that males have infertility.
Okay, and this is another aspect we need to cover, but one thing is the gene or the chromosome for the male is carried by the
Yeah,
man.
it is.
So the gender is decided by the male.
Yes, it is.
Okay, so
They are
that's not a
female
woman's
and male sperms, and the Y sperms are faster, but sometimes they are wholly and solely female sperms are present.
Okay.
So then what happens is every time there's a girl.
Okay.
So it's nothing to do with the female.
Yeah, and now what I want to ask over here is that, we do obviously in urban areas, we do have a tradition of going to a gynecologist every now and then. How many times is it recommended to go to a gynecologist, get the ultrasounds or whatever done within the first trimester, so that we can move on to the second one?
Dr. Sayeda.
It is important that they meet in every trimester. Somehow we think if we've done 5 visits to the doctor, everything is fine. No, it is that you have to see them every month initially, and once you're 7 months pregnant, then you should visit every 2 weeks, and in the last month of pregnancy, you should visit them every week. The reason being that things can sometimes go wrong very quickly. The blood pressure can rise, or maybe the baby becomes very weak, or it is not picked up. If you see the doctor at 3 months interval, the girl may become very anemic, and the baby may become weak, or maybe the baby even dies inside the mother's tummy and she doesn't know.
Oh, wow.
So you have to have a regular checkup, and the purpose is keep an eye on her blood pressure, keep an eye on her weight, keep an eye on how the baby is growing and how is everything going on.
Okay. Now the thing is, I think we skipped over the whole mood swing thing a bit too quickly. I wanted to actually have another question regarding that. Now, I think I have my brother recently. He didn't have a child. I mean, we say he had a kid, but my sister-in-law had a child. Now, I think we realize the impact that pregnancies has physically on a body, which then has an effect mentally and, psychologically. There's something living inside of you, which is like taking out all the nutrients. You're giving it nutrients. It's taking the calcium from your bones as well. That's true, right? So, everything's being taken out of your body. What impact will that have on someone's mental peace of mind? Because there are a lot of couples that they do struggle during these 9 months, and like you said, stress is not healthy for the baby. So what can we explain what's actually happening to the female?
Actually, there are tremendous changes in hormones. They may 100-fold from what they were when they are not pregnant. So things can change that much, and it has been shown that immediately after delivery, the incidence of postpartum depression rises exponentially,
Right.
because of the change in hormones from the pregnancy state to it suddenly troughs. It just goes down.
Okay.
And many women have pathological depression at this time. Any woman who's sensitive is more likely to be caught by a depression immediately after the baby is born. She's going to be weepy, she's going to be unreasonable, and she's going to be tired, not sleeping. And if the family is aware that this can happen, then only they will seek help. Otherwise, they'll think, it is a jinn or something has happened, and, a bad eye has happened to our
And people
child.
do not even take it into consideration, because for all those people who live in joint family systems, I think they probably tend to keep it behind the doors as well. And this is a problem, so people need to be very open about
Sorry,
it.
Dr.
Dr. Saira.
Yeah, the mood swings, they happen more to the women, the girls who have a premenstrual syndrome.
Okay.
When there is a cycle, monthly cycle, before periods, some girls, they become irritable, short-tempered, weepy, body swells up, and that is effect of a simple certain hormone,
Yeah.
which is 100-folds in pregnancy, which is progesterone.
Really?
It rises so high. So mood swings are very acceptable. It happens.
Yeah.
And we should, it's a part of pregnancy.
Right.
And patient's mind changes. My consultant used to say that that's her right, because she's going to have a baby. So just bear with her, one thing. The other thing is that I will quote an example. I have a patient, she is 21 years of age, her first baby. Her husband is businessman, very rich. She comes in a pajaro, or but she wears hijab, burqa. Whenever she comes, she cries. Whenever she comes, she cries. She's VP. And now I am thinking that she will go into postpartum depression. This is a sign of depression. This should be recognized antenatally.
Okay.
But to tell her or her family that
Yeah.
she is going into depression is a very illogical thing. We have to be very subtle with all these findings. And yesterday her husband came, and I called him in, particularly called him in. I examined the woman. Whenever she comes, she's 36 weeks. Do my cesarean section. Do my cesarean section. I can't bear it anymore. So I lied her on the couch for examination, and I said she has a burn here over the tummy, huge burn. I said, what happened? She said, वो चाय डालते हुए उलट गई थी. You can imagine that a big tummy, and she's a short girl, and she's cooking, and she's trying to pour hot tea from the pan. Then I called the husband in. I said, is there no help at home? She cannot do kitchen work anymore. It's dangerous for her. And she survived. The whole chai could have been on her.
Exactly.
A big burn.
Yeah.
And that guy, he is a businessman, but I don't think he is highly educated.
Yeah.
You know, that's not my question, but my point was to call him in,
To see what the support network was
to
like.
support them, to counsel them that she's not going to work in the kitchen anymore. Her feet are swelling.
Did he listen?
Yeah, he did.
Oh,
Well, the people do tend to listen, but we really do not know when they go back home what happens and what does not happen.
No, we have to be very polite and very subtle.
Of course.
You cannot blame anyone.
No, of course.
So when you are very subtle with them, you
Then
can
they take it.
communicate each
So now
other.
let's very quickly move on towards the second and the third trimester as well, because we were supposed to discuss the pre and post, but we are so jacked up with pre. Yeah, go ahead.
Pre, during.
Yeah.
Second trimester is after 3 months till 22 weeks. 28 weeks. And the thing is that in that era is important, because if somebody has a weak uterus, congenitally weak uterus, that is the time when you lose your pregnancy. The baby moves, the woman feels the movement, and suddenly the membranes, they rupture, and the mouth of the uterus opens up and the baby is expelled.
Okay, now how do we figure out if someone has a weak uterus, Dr. Saida?
Oh,
sorry.
okay.
Yeah, now that is why I was saying that the patient has to see the doctor frequently. If she visits every month, it will be picked up by her symptoms of too much pressure down below, and when we do an ultrasound, we can see the mouth of the womb, which is known as cervix. It starts opening up. And if that is happening, then there are various interventions we can do. We can give her certain hormones, we can put in a stitch. Depends on what is appropriate for her. So if she has regular checkup and she reports it to her gynecologist, whatever her problem is, communication is extremely important. That she talks to her gynecologist that this is my problem.
Okay, there's one more thing, Dr. Friesa, which I would refer to, and that is that usually what happens that for all those people who have been going to the doctors and they, if they've picked it up on a very early stage that something's wrong, what time is it the right time to abort the pregnancy, do you think? And then there's religiosity which is being indulged into it too as well. So for example, because when the heart starts beating, then people have different concepts. So let's debunk this myth as well. Can we do it or can we not? Or if we do not do it, what can be the repercussions for the mother?
Why would anybody want to abort the baby, That's the important point. Supposing on ultrasound it's an abnormal baby with no head, that's called an anencephaly. Anencephaly is without a head. So that is picked up. Yeah, that happens, and it's quite common, and it is because of folic acid deficiency. So if that happens and the head is absent and it's picked up very early in the pregnancy, so a termination can be performed and it is legal to do it. But if for no reason going for an abortion is legally also wrong and religiously also wrong. Our country's law says 3 years imprisonment if abortion is done for no reason. for example, for contraceptive reasons. So these are gray areas which probably we should not be treading
No, for
upon.
example, there are people who, or when they go to a gynecologist, and when they do the ultrasound, they say, because I've been through this myself, and then what happened was that the doctor said that the upper part of the brain is not connected with the lower part of the brain.
Yeah, that's what I told
you.
you.
The kid cannot walk, the kid cannot sit, the kid cannot do anything.
Then the termination is recommended.
Till what time?
A good time to pick up is by doing an anomaly scan at 18 weeks. It is recommended. All over the world, 18 to 20 weeks of pregnancy, an anomaly scan is recommended. And the reason is because the whole of the baby is formed, all the organs are developed, everything is developed, and by then most of the anomalies are picked up. And if an anomaly is picked up, such as a hydrocephalus, an anencephaly, that is a head with the water in it, or an absent head, then a termination, it can be performed by 20 weeks.
Okay, Dr. Saida, do you have anything to add on this? Because you're at the government hospital, so.
Yes, we actually, when we are working in government hospitals, we see all the complicated cases. And there is a lot of ethical dilemma. No doctor or gynecologist would do a termination which is unnecessary. But any lethal anomaly in the baby up to 6 months, you are expecting that this is not a baby which is going to survive. But up to 6 months, they can be offered a termination if it is safer for mother and the baby. Otherwise, after 6 months, it's a viable baby. It's a baby which will survive no matter normal or abnormal. Then we let them continue. Some people get to know about it in the 7th month, and we say we have to deliver them on whenever it is due and look after the baby to the best of our capacity.
Okay. But what if they don't have the capacity to look after the baby with those problems?
There's a
You
moral
don't have
and
a choice
ethical
then.
dilemma because the
Yeah, that's
baby,
what the
if
moral
born
and
after 7 months,
Yeah.
will remain alive.
Okay, yes, sorry. Yes,
Dr.
Dr. Thyra.
When you diagnose a congenital malformation, then you decide whether it's compatible with life or incompatible with life. You counsel the couple, you counsel the family, whole in-laws are being counseled, and then the decision is left to the couple.
Okay.
You want to get rid of this pregnancy or you want to continue.
Okay.
The religious ones, they said, yes, I will continue with the pregnancy. At term, the child is born, she goes into labor, have a normal delivery. We don't do a cesarean section for them, and we don't harass them. That what are you going? I mean, we don't have any negative thing to say.
Yeah, of
We
course.
just say that this baby might not survive after.
Yeah.
Might. There's we
The
have
word,
to.
yeah.
Yeah.
The word is might. The other is that if somebody has already have an abnormal child, they said we don't want to suffer anymore. We are suffering with one. Then they make their decision. So it's very open, and legally, as Dr. Sab said, any congenital malformation. But for a healthy, normal baby, nobody will terminate the pregnancy.
And then one last thing before we wrap up, and that is that so you keep on going to the gynecologist, you're getting all the checkups done, and
Very
then
important
the ultrasounds are being done. You've always been going after every 2 weeks throughout 9 months' time. All of a sudden they tell you that tomorrow is going to be your delivery, everything's fine, super. You go over there, and then there's this lady who came running to you, or there's been a problem, and we're going to do a C-section. See, for a person like me or anybody who's a layman, who's not a doctor, does not have many options, in fact, does not have an option. So all we have to say is yes. So how many times do you think that it is being faked, and how many times do you think it was needed?
If you allow me, I will say that you expect your doctor to be ethical. And if you're seeing a doctor, you've seen that doctor 10 times in the pregnancy, you have the confidence that this doctor is going to do the right thing for you. And I think that is true for a lawyer, that is true for a bureaucrat, that is true for a doctor. So you expect ethical and right things from your doctor. If you do not have a confidence in your doctor, then that relationship is faulty. And 20% of pregnancies will end up in a cesarean section. Why? Because maybe it is to save the mother's life. She's got too bad a hypertension, or maybe her pelvis is so contracted that she cannot have a baby, or the baby is in distress. The heartbeat is not right, and if it goes through 6 hours of labor pains, we may lose the baby. So there are different reasons why you do a cesarean section. But this is a very recent, repeated refrain from my patients as well. Doc Saab, you said it's going to be normal. Why is it a cesarean section?
Okay, so we've actually completely run out of time. We're like being shouted at to say.
But Dr. Thyra, very quickly, you can complete.
The thing is that when you are
Very
seeing-
quickly.
when you're seeing a couple throughout pregnancy, when the last month come, everybody wants to have a normal delivery. So there are certain factors you tell them, and you counsel them.
Yeah,
that you
okay, but we've actually completely run out of
That's
time.
okay.
Absolutely. Thank you so much for being here today. It's been an absolute pleasure. And we will get you back to talk about the post-pregnancy. But with that, guys, do log on to our Facebook fan
It
page.
is with the name of World This Morning.
Our Twitter page.
World This Morning without a J.
Our Daily Motion and
World
YouTube
This
page.
Morning, World This Morning.
And the repeat is at?
11 p.m.
Have a wonderful Monday, and we will see you bright and early tomorrow morning.
Till the next time, good morning. Thank you very much.
Thank you.